This study explored integrating acupuncture with gonadotropin-releasing hormone agonists like Lupron, improving endometrial receptivity and pregnancy outcomes for patients experiencing recurrent implantation failure during frozen embryo transfer cycle. So they compared conventional hormone replacement therapy, so standard frozen embryo transfer protocol, with gonadotropin releasing hormone agonist combined with acupuncture. They looked at a total of 164 patients, so I guess that'd be 82 in each group. And they tracked things like endometrial thickness, endometrial morphological classification, submucosal uterine blood flow, as well as clinical pregnancy rate, embryo implantation rate, and early miscarriage rate for both groups. So we'll get into the results. So in the acupuncture combined with the GnRH agonist group, they saw that there was enhanced endometrial receptivity. The combination therapy significantly improved the receptivity to endometrium, making it a more hospitable place for embryo implantation. They also noticed improved pregnancy outcomes. So patients receiving both acupuncture and GnRH agonists showed higher pregnancy rates compared to those who did not receive treatment. This study also showed improved uterine blood flow, which was pretty cool to see that improved during an actual cycle. That's something that's been shown in research to have happened just on its own, but they've never really looked at it in terms of a cycle. So that's pretty cool. So this study specifically showed that women with type 3 submucosal uterine blood flow increased, and the number of women with type 1 submucosal blood flow decreased. So just to kind of recap what that means, women with type 1 submucosal blood flow is characterized by high resistance, low blood volume. This type of blood flow is typically less favorable for implantation of pregnancy outcomes, whereas type 3 exhibits low resistance and high volume blood flow. It's considered much more favorable for implantation and successful pregnancy. It indicates a well-vascularized endometrium, which enhances the chances of embryo implantation and subsequent pregnancy.